Dr. Woeller is an autism physician. He is a specialist in the field. He has over 2 decades of experience treating individuals on the autism spectrum. He created a step-by-step guide through the confusing, sometimes unsure territory of biomedical intervention. So welcome, Dr. Woeller. Thank you for being here today.
Well, thank you, Ilana. It's a pleasure to be here. So yeah, thank you very much.
What is biomedical treatment?
If you think about how autism is framed from a diagnostic standpoint, and it's categorized obviously as a neurodevelopmental problem that incorporates aspects of language, socialization, and of course we have behavioral issues. But biomedical intervention looks at autism not just from a neurodevelopmental standpoint, but understands that for many individuals, whether it's a child, teenager, or adult, their neurodevelopmental issues oftentimes are linked to underlying biological or medical reasons. Now, in part, that could be genetic, there could be some other hereditary factors, but it's well known now that environmental factors can play a role. Whether that's chemicals, whether that's heavy metals, what's also known as mold or mycotoxins are contributing. It's not usually one cause, it's multiple things that are contributing to the problem. And so biomedicine, or another word for it is called integrative medicine, looks at an autistic individual and says, okay, we've got this condition, right? We know that there's behavioral issues, cognitive problems, etc. But is there something medical that's either causing or contributing to it? It's well known in autism that digestive system problems are a major comorbid issue. And this is even data coming from the Centers for Disease Control here in the United States, recognizing that cognitive abilities, language, behavior is often negatively influenced by digestive issues, whether that's diarrhea, whether that's constipation, whether that's an infection of some sort. So it's well known that a lot of kids have gut problems. And we know that some kids, when I say kids, by the way, I'm really referring to sort of the whole group of individuals. I should say individuals. Some of them have inflammatory bowel problems. And so when you work on the gut, whether that's by treating infections, implementing different diets like a gluten casein-free diet, there can be improvements in the autistic condition. So I wanted parents to understand that there is hope, that there is help, that if they have a child who's been diagnosed, that if they get told by their pediatrician or their general practitioner or the neurologist that there's nothing they can do, it's completely false. In fact, I've even had parents come to me where their doctors have told them, oh, don't bother with that diet because it doesn't work. Or don't do supplements because, those aren't helpful. And that can't be further from the truth. Basically, what you're getting is false information from practitioners who doesn't mean they're not well-meaning people. They just don't know what they're talking about. They don't have any experience in these types of things. I firmly believe that every individual with autism, regardless of what triggered or what the developmental aspects of their autism were, can at least be helped in some way. And to me, the biomedical approach is absolutely essential in that process. Speech therapy, behavioral therapy, physical therapy, those are also helpful and complementary. But if you've got a gut infection, or if you have food sensitivities, or you have some kind of chemical exposure, those kinds of things need to be dealt with too. And when they are, there's often greater improvement that we see for autistic individuals.
I love how you use the words help and hope. I spoke to a parent last week who was consulting with me, and she told me that she went to the top developmental specialist in our city in Johannesburg, South Africa, and the specialist did make the diagnosis of autism for her 3-year-old son. And when he made the diagnosis, he said to this parent, and don't believe the rubbish that you read Special diets won't help you. In fact, the parent had told this doctor that she'd taken her son already off gluten and dairy because she'd started reading about these things, and she was reading about a possible autism diagnosis, and this developmental specialist, who is considered the top person in our country, said, I want you to put him back onto gluten and dairy. Now, a lot of parents will tell me that their child is a picky eater. What does it mean if a child is a picky eater?
Well, there can be a number of reasons. Picky eating can occur because of some kind of sensory problem in their nervous system, where they don't like textures of certain foods or the way it smells. So there may be a sensory behavioral issue. Sometimes the picky eating comes about because they don't feel good within their digestive system, right? I mean, just think of yourself as an adult, right? There's certain foods you can eat and not tolerate, and so you avoid them. But many autistic individuals don't have language, so they can't express themselves and tell you how they feel. So they only can, they avoid something or they act something out. The other reason that picky eating can occur is that some of the foods are causing a chemical reaction in the brain. And this is a known fact to occur scientifically through the actions of certain chemicals in gluten and casein. So gluten found in wheat, casein found in dairy, cow dairy. And these are chemicals that have an opiate effect. They actually have an opiate chemical structure that interact with the brain and nervous system like an opiate medication would. And this can affect brain function that in some individuals can lead to limited intake of foods or limiting dietary choices. A number of conventional docs will say, your child's autistic. By the way, there's no cure. We don't have any options for you, but make sure you don't go do the diet and supplements because, that doesn't work. And then somebody says, well, is it harmful to try a diet? Is it harmful to try some supplements? Well, no, it's not harmful, but don't do it because it doesn't work. And doctors are classic for this in that many of them will give an opinion about something they know nothing about. As a parent, you have to look at things and think, does it make sense in what I'm reading and what I'm hearing? Does it ring true to me? I mean, there are so many different types of chronic health conditions that are influenced by diet. It doesn't mean it's the sole cause, okay? But you don't have to dig very deep anymore into medical literature, even into just sort of common public information about how diet can influence other health conditions: Alzheimer's, Parkinson's, multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, anxiety, depression. I mean, so this is very well-known common things. It's just that you have some practitioners who either choose not to look or don't really bother to put any work into it. So again, if you're hearing those kinds of things, if they're getting a negative response, seek other opinions and continue to seek information. I wouldn't be doing this, okay? I wouldn't be sitting here for 20 plus years if dietary intervention didn't work. Okay, why would I waste my time and waste families' times by suggesting interventions that are not helpful? So same with supplements, same with other things that we do from a biomedical standpoint. That doesn't mean that everything that is recommended is going to help in the same way for every single child, right? Each child is still an individual. But by and large, what we implement, gut treatment, diet, supplements, are helpful and many times significantly helpful for a good 80%, 85% of individuals that we work with. So those are pretty good percentages.
A lot of the parents will say, my child will not fall to sleep. They will not stay to sleep. We are exhausted. We cannot function. Why do children with autism have sleeping problems, and what are the possible solutions?
Some of it can go back to diet. So there could be food sensitivities that trigger stress hormone release at nighttime that can interfere with sleep. There may be certain nutritional deficiencies that can contribute to it as well. Of course, there are sensory imbalances within the brain and nervous system that can affect sleep. I've actually had some kids who have chronic gut pain at night. So what you have to do is go through sort of a litany of questions, and from a clinical standpoint, reflux, for example, can lead to sleeping problems. But again, if a child is having reflux of acid into their throat, getting chest pain, they can't tell you about it. They can't come up and say, hey, mom and dad, my chest hurts, right? They're just not sleeping, or they're agitated. The other thing that can happen is that there's a lack of production of a hormone called melatonin. And melatonin is the molecular equivalency to darkness, but there's been some studies that have shown that certain autistic individuals don't produce it in an adequate amount, or produce it in a correct timing fashion that helps people to sleep. So sometimes a melatonin supplement can help, 1 milligram, 2 milligrams or so, about an hour before bedtime. That could be helpful as well. And sometimes that works like a charm. I wish it worked in every single situation. But we have to start looking at things medically. Okay, are there food sensitivities? Are there gut problems? Are there other environmental factors that might be interfering with sleep? I've actually had some kids sleep being interfered because they have a computer or a laptop or a cell phone sitting next to their bed, so just the electromagnetics may be playing a role too.
Tell us about the most important tests you recommend. And I know it's always going to be child specific, but what are the top 5 tests you would recommend?
We know that getting a blood draw on a child with autism can be challenging, or even a teenager or adult. So it's not that doing a blood draw isn't important at some point, but there are many tests that we can do that don't require a blood draw up front. So the first one is the organic acids test. Great Plains Laboratory has been around for many years. I've worked with them, I lecture for them, and I've also used their tests very successfully in my practice. I always tell parents in my practice, if you can only afford to do one test right now, right in the beginning, do the organic acid test. If we can do other things, fantastic, but at least we can start with this, because it gives some inroads into digestive imbalances and other metabolic problems. A complementary test to that is called a comprehensive digestive stool analysis. And this is simply looking at healthy bacterial levels, pathogenic bacteria, parasites, inflammation, digestive markers. So the organic acid test and the comprehensive digestive stool test complement one each other. Another test that in this, I like your 5, by the way, 5 most important. There's a lot of studies in IgG food reactivity that's linked to worsening situations in autism, worsening behavior, language problems, cognitive problems. Great Plains actually has a blood spot. It's a finger prick, so people can do these tests at home. The 4th test that I recommend people do is a hair metals test. And the reason is a hair analysis provides a snapshot of mineral imbalances. You're not going to be able to assess all minerals equally to what you would get from a blood test, but it does a pretty good job for common minerals like zinc, manganese, selenium, and lithium. I actually find a lot of autistic individuals very low in lithium. And people hear lithium, they think the medication, but lithium is actually a very important mineral in our bodies because it helps protect the brain against stress. So when our bodies are low in lithium, there's a greater chance for anxiety, irritability, and panic type of responses. And then the 5th test, as far as this, initial set, is what's called a mycotox profile. Mycotoxins are toxins produced by mold. And this test is relatively new. It's been out a couple of years. I wish we had it a long time ago, because what we're finding is a lot of people with chronic health issues, particularly brain neurological problems, are harboring these mycotoxins in the body. And some of them can have really profound negative effects. For example, there's a specific mycotoxin called ochratoxin that comes from Aspergillus mold. Well, in autism, it actually inhibits certain neurochemicals in the brain that can affect attention, affect behavior, affect a child's ability to learn. That's where I would start.
I have done the organic acid test many times for both my boys, and it's always really been so useful to see the results, understand the interpretation, and it's really guided me on the treatment protocols for both of them. They really are amazing tests. And, you know, I love the 5 tests that you chose because as you said, we don't have to take the child necessarily for a blood draw. I've taken my kids for many blood draws over the years, and I have many stories to tell about those blood draws. I mean, you come out of there and, you know, you just want the earth to swallow you up. It's really encouraging for parents to learn that you can do a urine test, a hair test, a stool analysis test, and I've worked with Great Plains many times over the years, and they're such a fantastic laboratory that I really highly recommend. It's not as hard as parents think. You know, parents will think, I can't use a laboratory in America. I need to use a laboratory in Australia or in the UK or in South Africa. It's actually so easy. It's not as complicated as you may think. So really take a look also at the Great Plains website. On your website, you talk about your 4 pillars to treatment. Please share those.
Well, about 80% of the individuals I'm working with tend to do very well with 4, fundamental treatments or treatment categories. And it came down to diet. Diet was number 1 on the list. And I say this to other patients with other health issues as well, whether it's an autoimmune problem or chronic fatigue or some neurological issue, is that if we don't improve our diet, it doesn't matter how comprehensive your supplement list is, you're not going to really move the needle that much. Pillar number 2 is foundational supplements. And there's a whole list of supplements, right? You know this. But when we look at the restrictive nature of diets for many autistic individuals, okay, where they don't want to eat a diversity of food. I mean, I've had kids that will eat like 4 things. Okay, and so as a child, we know, and this has been also studied, many of them are nutrient deficient in certain things. And if we're not getting the essential nutrients, right, the system becomes compromised. And so to me, foundational supplements, multivitamin, mineral, essential fats, calcium, magnesium, these types of things, they help to fill in the gaps nutritionally and help to support certain critical biochemical systems that may be under-supported. So that's always critical. The 3rd pillar goes back to the whole comorbid situation in autism with regards to gut problems. We know that autistic individuals tend to have a lot of gut issues, and many of them have overgrowth syndromes, yeast, including candida, digestive bacteria, sometimes parasitic infections. And so we have to work on the gut in order to help try to heal the rest of the body, because there's actually a communication network on multiple levels between the gut and the brain. The 4th pillar is what's called methylation. And this is a larger topic, but methylation chemistry in our body is really critical for brain development. It supports language, it supports eye contact, it supports environmental awareness, it supports detoxification, immune function. There isn't really one component or an area in our body where methylation doesn't have some influence. This is also one of the areas that's been heavily researched in autism too, is methylation imbalances. And so there are different supplements that can help support methylation, but it's understanding that methylation imbalances that could be occurring because of a B12 deficiency or a folate deficiency or some type of genetic influence.
When my youngest son was showing the symptoms of autism, we started treating his methylation cycle very early on. And it was so interesting to see how supplementing him with folate had such a dramatic result. I mean, within 48 hours, I started to see an alleviation of the autism symptoms. For Aaron, it was dramatic. You know, it's not always going to be for every child. And if you try something, sometimes it could not be working because you may need to increase the dose or play a little bit with the times of day you're giving the supplement. But we really saw an improvement in his language skills when we started to supplement folate. And when I actually did his DNA analysis, we could see there was a NTHFR methylation issue for him. Before you go, I would just like to ask you, how can parents get in touch with you?
My private practice, and it's called Sunrise Functional Medicine. I work with people all over the world. And then there's the Autism Recovery System website where people can interact with me on an ongoing basis. I mean, I have people who post me questions every day through the forum of that website. And then there's Lab Test Plus. Real quickly, if you have, and I don't know if there's practitioners out there, sometimes a parent may be a doctor themselves. I also have some professional websites for health care practitioners. I actually have an entire course that is very comprehensive, designed for healthcare practitioners, called Autism Mastery Course. And that's the website, autismmasterycourse.com. And then we have a website for healthcare practitioners called functionalmedicineclinicalrounds.com. And that's a place where, but yeah, I'd be happy to come back too. We can do a part 2 of this, maybe even a part 3, whatever you want. I can always make myself available.
I'm so excited. I think we're going to have a lot of parts. This is just the beginning. For what you've done for so many parents and children with autism around the globe. Thank you. Thank you from the bottom of my heart. On behalf of the autism community around the world, you are such an amazing specialist, physician, specialist in autism, and we are very grateful to you for everything that you've done for so many children over the last 20 years.